So you made a lot of changes, which is good.
Yes.
But the
But
way
it's still not good.
the way it is laid out is not satisfactory.
Okay.
Okay.
So first, because image taking is important, right? And you want
Okay.
to take good photos.
Mhm.
Once you have them, you want them to look good.
Yeah.
Right now, it does not look good.
Okay.
Because what do you see? I just see the trash can here and here,
The trash can was bugging me yesterday.
right?
Yeah.
Oh, okay.
You know, when you take
Christian.
photos,
Photographer.
You have to pay-
gave you. Do you
You
want
have to
actual
pay
pictures
attention
of
to
ourselves?
details.
Of ourselves?
No,
Oh no.
no. But I want
Okay, we'll
details,
go right now again.
right?
Okay.
And then here you have a subject, blue. The cup is black.
It's
I
hard to
don't see where the cup is,
Yeah.
Okay,
That's
we'll work on
the
that.
part.
right?
Yeah.
And you know, posture was very important,
Yeah.
right?
Uh-huh.
You have a certain posture where how the patient is
Sitting.
supposed to sit,
Yeah.
right? And you
Yeah.
explain that. But here it doesn't show,
Oh.
right?
Mhm.
You don't need the face, but at least a little bit of the side of how the posture is,
Exactly.
right?
Mm.
What did I tell you?
What did he tell you? No,
He said we need his face in it.
I have more. They just didn't want to put pictures.
because
of themselves.
all of the things that you said,
Yeah.
I want it in the picture
Okay.
so that you just point to it,
Okay.
okay?
Yeah.
And then you talk about it, but then the people will look at the photo to check that this is correct, right? So these are images that needs to be taken again.
Perfect.
And then here, why is the side of the table here? If you just use the white background, just use the white background, right? And if you can have a number here, that would be nice to see the number.
Mhm.
Okay.
And if you don't get the number, you can override here on the PowerPoint.
Okay.
You can have the number there.
Oh.
Okay, that's what I usually do.
Yeah.
If I don't get the picture in, I at least put it on
top of
there.
it, yeah.
Okay. And then I asked you, don't start with the aim of the study.
Would this
Okay.
one be okay?
Yes, it's okay. But
But
it has,
more to the
yes, it
side.
has so many noise. We call it noise in the picture,
Oh, okay.
right? If it's good to have the clinic, but you
But
don't
not
want to
that.
have too much noise.
Okay.
You want
Just
to
that.
see what they should see.
Okay.
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 And that's why the trash can is annoying.
Annoying. All right.
Okay.
All right. No worries.
Good, good. So how are you going? And here's your introduction,
Yes.
right? And then you have discussion and conclusion here. Discussion and conclusion should be on this side, right?
Oh. Okay. Yeah. That makes sense.
That makes sense. And then the materials and methods, you could have this chart over
There.
here,
Put
right?
that there.
And then this flow chart, you have too many flow charts.
Mm.
Do you need both, really?
We could probably take the bottom one out. I think.
Yes, I think you just should have a representative flow chart, and this I think looks good. Have this here, right? Remove this one, right? And then you have these three
Larger.
images here,
Uh-huh.
right?
Okay.
And then you start with your results here, right? The results goes here.
So she said we would leave this one?
Oh no, we'll do. Yeah, we'll take that one out.
Let's look. Just a rough idea of how you should space it, right?
Okay.
Mhm.
And then the results come in here.
Mhm.
And then all of your results pictures go in here as you had last time, right? I think yesterday you had it over here.
In the middle. Yeah.
And then where is your discussion? Is this your discussion?
Yes.
Okay. Yeah. Oh. Yeah. Discussion went away. But that's
It
okay.
doesn't matter.
Okay. So it doesn't matter. But
No,
you
it's the
see
conclusion.
the logistics, right?
Yeah.
Of how it should be
Mhm.
spaced. And then now I want you to tell me, or not looking at this.
Mhm.
Who did the introduction yesterday?
Me.
Kevin, can you start with the introduction?
Right now?
Okay.
Wait, so I had a question before we start this.
Good.
So I know it's still a little bit complicated. I was trying to simplify it. I don't know if this was necessary to have right here where it says the hypothesis. That part,
The
you want me to
hypothesis
keep
is
it there in the
Uh-huh,
introduction?
uh-huh.
Okay.
So the introduction is, and I told you, it's a storytelling,
Mhm.
right? It's a storytelling because 7 minutes is a short or a long time, depending on how you see it. But in the 7 minutes, you want to tell a story to the people who are standing there, and you want to make an impression to the judges, right? And the judges are listening to 8 presentations, so they are overloaded with information. Yours is good because you are number one. You will start. They are getting a fresh start with you,
Okay.
right? So how on if you start the aim of the study, it's like, oh my goodness. They have no background of what to expect. So you have to really give a little bit of background why you did it. Why did you do this?
Okay.
So you could start with blood pressure taking in our
Yeah.
dental clinic
Mhm.
is very important, right?
Yeah.
Because it dictates of how we treat our patients,
Mhm.
right?
Yes.
And what we have to take into consideration when taking these patients. So this is just a foundation for us as dental hygienists or for the dental students to start the treatment, right? And making a proper to do a proper diagnosis, treatment planning, and treat the patient, right? That's very important. Blood pressure taking is important. At our school, interestingly, at our school, the way blood pressure is taken is different from the dental hygiene for the dental hygiene program and the dental student program. We are trained to do a manual. We are trained to do it manually, while our DDS students just use the electronic measurements. So with these two different types of educational approach and methodology approaches, we are very curious whether there is a difference in blood pressure taking in manual versus electronic. And since we are working on the clinic, which has different noise levels, we are also curious whether this would be whether blood pressure taking, whether it is manual or electronic, would be affected by the noise level.
Yeah.
So you told a story of
Yeah.
why you're doing it, and now they are prepared to listen of what your purpose was or your hypothesis was, what the results were, right? And then so therefore the purpose of our study was to do this and this and this,
Okay.
and we hypothesized this and this and this, right?
Okay.
And then you go and for our methods we did this and this and this.
Yeah. Me.
For the blood pressure taking, we had one who was trained to do this. Okay, don't say in order to reduce what did you say?
Bias.
Bias. You don't have to say that. We used a trained
Okay.
examiner, right? And one examiner did all the measurements
It's
throughout the study.
calibrated.
Okay.
Okay.
And then you explain how you made the measurements with beautiful pictures. The noise level at the quiet setting was, the average was this. The noise level that we determined to be a noise level was this, right? You have the big numbers in your results versus this. And then you explain your results, right?
Yes.
And if this does not show well, what is good, you superimpose lines
Mm,
on
mhm.
the PowerPoint so that it looks, and
Clear.
you can, yes, because this might not even show well. Okay? So
Okay.
you think about it, how to make these graphs more attractive.
Okay.
Okay?
Yeah.
And then you have your discussion, right? And your conclusion and your
Reference.
references.
Okay.
Perfect.
I just have a question. I think it might be a little too specific, but to add to the story you just said, like, what if we talked about like how the blood actually goes into the heart and the heart pumps up blood? Should we
No.
talk about that? Okay,
No.
it's probably too specific. Right? Yeah.
Her
Okay,
face.
I just-
No,
yeah.
no, no,
Okay, I just
no.
want to make sure. Okay.
Yes.
Yeah. Okay.
Yes.
Yeah.
And just your results. Explain me the results again.
Okay. Yeah. So we
What were the
basically.
results?
Okay, the results was basically so I can report like the p-values for what we found was so two of them, the diastolic for in both quiet and noisy environments, for both manual and electronic, were less than 0.01.
No,
So-
that's not what I wanted to say.
Oh.
If you explain it like this,
Uh-huh.
the p-value was what? Nobody understands what the results are. What were your
Okay.
results?
Okay, so
You did something, right?
Yeah.
And I did the introduction. So what was the results?
The result was that there was a significant difference in between
Between
there was a significant difference in both environments of quiet and noisy for the manual and electronic
no,
diastolic.
no. Can you break it up so that we can
Okay.
understand?
Okay, make it more simpler. Make it more simpler.
So just say
yeah.
something for the quiet environment first.
Okay.
And if it was the same in your noisy environment as was in your study, right?
Mhm.
You explain your quiet study, and the results were the same,
Same for
in the noisy
noisy.
environment,
Okay.
right? So what was it in the quiet?
Okay, so so our results were significant for in the quiet environment, comparing the manual versus electronic devices.
No.
Oh wait, no? Still okay.
If you say significant, nobody knows what is significant. What were
Okay.
the results?
The diastolic reading was lower in the manual readings compared to the electronic
right?
in the quiet environment, and it was the same
And it was statistically
significant.
significantly different,
Different.
right?
Yeah.
So the reading were higher with the
With the electronic.
electronic,
Mhm.
right?
Yeah.
Hey, that's what
That's
I
it.
want to hear,
Okay.
right? And that's
Yeah.
very important for you to convey to somebody.
To the-
but
yeah.
but if you start with it was significant in the noise inquiry, then I have to think what were the results. Can
Okay.
you repeat one more time your results?
Okay. So the diastolic blood pressure readings were higher for the electronic device in the quiet setting and
No.
in the clinic
Compared to what?
compared to the manual blood pressure cuff in the quiet setting, and the results were same in the clinical setting. Yeah.
Yes, the wording is very important. And if you say manual blood pressure readings all the time, then it's
Redundant.
just redundant and it's difficult to understand. You measured blood pressure manually and electronically. From now on, once you have said so, you said manual readings, electronic readings. Electronic readings were higher compared to manual
Manual
readings
readings.
in the quiet setting, which is interesting. And what
There
was
There was-
really interesting was that it was the same.
for
The
the
electronic was higher compared to the manual, even in the noisy
it's the same.
reading,
Yeah.
right?
Okay.
So
Yeah.
that's your key. What you want to,
Yeah.
and the difference. What was the difference? If you say higher, the mean,
The
the
range.
uh-huh,
Oh, okay.
was what?
6 Oh, I'm sorry. I'll look at that again. But I remember I have the range or the difference for the decibel, like the range of how um, the difference between the noisy and quiet environments. So that was about 6 decibels, and then I'll do the same for
No,
the.
because you have to have, you don't need the range. I think it would be good to have a mean. So how higher was the electronic reading compared to the manual in
Yeah.
the quiet environment
Mm-hmm.
and in the noisy environment?
Okay.
What was the mean?
The mean was about 69 for.
No, no, no. What was the difference?
Oh, the difference was about 6,
5 to 6.
5 to 6
Right. So
mmHg.
you want to make sure,
Mm-hmm.
because then I think the numbers were pretty much the same
Mm-hmm. Both.
for the quiet and noisy,
Mhm.
right?
Yeah.
It was always 5 to 6
Yeah.
higher,
Mm-hmm.
right?
Yeah.
So that's your results, and that's what you have to say.
Okay. Should we also say the units like mmHg?
One time, yes.
Okay, just one time, and then we'll just say there's a difference of about 5 or 6 in.
So who did discussion? Because
I did also.
so you did intro, you did
Materials and
methods.
methods, correct.
So I did results,
You did
but I also
results.
did the discussion.
What are you doing?
Conclusion.
Oh, what? Or just the conclusion?
Yeah.
How come? You did too much work with the measurements?
Yeah.
You're
He was
exhausted?
He's a little exhausted, yeah.
You're exhausted?
He's looking cranky.
Cranky? Do you want to do the discussion?
Actually, I kind of want to do the discussion.
You want to
And
do
then,
the
do you want to do the
results?
results?
I can do the result.
I think
Okay.
you should split it out
Yeah.
by section and
Okay.
not have something in between. Okay.
Okay.
So intro, method, results, discussion.
Discussion, okay.
And the discussion. So do the
Okay.
discussion.
Yeah.
What is your discussion
Discussion.
points?
So as from what I remember what you said yesterday, so the results will just be reporting what we found, and then the mean and the difference in the ranges, and then the discussion would be kind of like what we were just talking about, like the that there was a significant difference, and that we found that. Oh wait, no. Actually, we would be talking more about why we
So
think
your
it's different.
hypothesis will be that there will be no difference in noisy versus quiet, and there will be no difference between manual versus electronic, right?
Yeah.
But both you have to reject because there was a difference between,
Yes.
right?
Yes.
So what you will say based on the results, we rejected our hypothesis
Our
because there
hypothesis.
was a difference between manual and electronic, right?
Yeah.
And then you have to say, so what does it mean?
Mhm.
What does it mean?
So what it means, I was thinking that the noise level in the clinic does affect the clinician's ability to hear the corrective sounds.
But that's not true, right? Because even in the quiet environment,
Mhm.
it was higher. With
Oh, the electronic
with
was
the
higher.
electronic, right?
Yeah.
So the discussion that you said yesterday is wrong because it was, if you say the noise level affected
Mhm.
the manual reading, then the quiet would have to be the same, right?
Because they're both.
But they're both off.
Mhm.
What does it mean?
But then wouldn't it be different because for the manual it depends on us being able to hear the beat, whereas the electronic doesn't have that factor.
Yes, but apparently, since the mean difference was pretty much the same, the manual one, you couldn't hear it right
Yeah.
with the in the quiet
Oh, I
as
see what
well
you're saying.
as the noisy environment.
Yeah, they were about the same.
right?
Oh, okay. That's true. Maybe the quiet environment wasn't quite enough for us to be able to hear.
Then you are disputing your research design.
Okay. Oh, yeah, that's true.
And wasn't it quiet?
Yeah,
how
it was
how
quiet.
quiet can it get?
Yeah. 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 Okay. So we're pretty much trying to say why we think why we got results, right? So,
So what you have to look into the literature now, in the discussion, references are important. And you have to see whether there are studies. There are studies that compare manual versus electronic. Okay? Now you have to find what the studies found and whether it is pretty much the same in studies that were done or whether your results are different. Okay? And then if your results are different from the literature, then you have to say, although we expected that in the quiet environment, right, the examiner or what the operator would have higher chances of hearing the beat better, right? Perhaps it was just due to the operator being a student who is, although properly trained, was not able to detect it at that critical time point. Okay?
so like experience would be a factor,
Yes,
maybe.
but you have to look at the references. Okay?
Okay. So compare what we got to what other people.
literature.
Okay. For the
That's
discussion.
the discussion. Okay?
Okay.
And if the discussion is, if the literature is the same thing as you found, then which is great, it's in accordance with what we found. And then if it's different, right, then you have to say, oh, we assume it was because of this and this. But we conclude, since there's a difference between manual and electronic, and electronic always higher, which means it's critical. If the manual always is lower, then we could really categorize high blood pressure patients as being low or just normal, right? So that's the critical point of your discussion. And that's why your conclusion is we would propose, since we are working as students and we want to have proper management of our patient, we would propose, our conclusion would be to switch to electronic for the dental hygiene program as well.
Okay.
Okay.
Sounds good.
So it's really looking into the literature.
So would I, in the discussion, would I like say that, oh, this study had these findings and this is compared.
Yes, similar studies were done,
Okay.
right?
Yeah.
And then similar studies were done. They're out there. You have to find them. You
Yeah.
have to find the most recent ones and most cited ones. But then you look at whether there's a difference or not. Number one, right?
Okay.
And then if people ask you, there have been so many studies on this, why did you do this? Then you are addressing your specific population, right? Which are dental hygiene students. And perhaps there has been no studies done with dental hygiene students, right? As the operator, I assume. Okay?
Yeah.
There will be many studies with nurse students, medical students doing this, but not with dental hygiene students. Okay?
Okay.
Okay. Yeah. Sounds good.
Sounds good?
So yeah.
Yes.
So,
Kevin, sounds good?
Okay.
So you will have new pictures, a new poster layout,
Yeah.
right? And switching the introduction part, tweaking the discussion part.
Yes.
Today is Wednesday.
Yeah.
If you can send it, tomorrow is the deadline.
Okay.
Okay? So you send it, and then I will look at it one more time, and if I see some changes that needs to be done, I will do the changes. Okay?
Okay. Sounds good.
Very
Alright.
good.
Sounds good.
Okay.
Quick
So,
question.
yeah.
So the graphs look clear on my computer, but on yours it doesn't. Is there like a difference why that happens?
Oh, we could.
Oh, that was the old one.
Yeah, actually, no.
No, this is the one that I downloaded.
Kevin, once you add it to the poster, it starts looking blurry.
Really?
And
Just like-
no, if I blow it up,
No, that's why blurry.
it will come, right?
Clear.
It will come clearer, but still it's
Oh wait.
Actually,
Because I think you have the old one, Dr.
No,
Kwon,
this is
because
what he.
you're not.
Okay, this is what Brian did though. Oh, never mind.
yeah, so basically, if I could show you real quick, yeah, I just basically, for these guys, they look kind of blurry, so I had, oh, it's,
What do you want us to do with the informed consents, by the way?
Do you still have them?
Yeah.
Give-
Do you?
I need to keep them for 2 years.
oh yeah, so I basically made, I made these, I just kind of put these over the, so yeah, so I'll just like put that over the,
That's
the
what
wording.
you do.
Yeah, and then I'll just kind of
Uh-huh.
make the lines
But
darker.
then also here, all of your, it's very important that you have a color scheme.
Oh, okay.
So for example, you have electronic, noisy, diastolic, right? All of your graphs are diastolic, right?
Mhm. Yes.
Right? So you don't need this diastolic here,
Oh,
right?
that's true.
Uh-huh.
To
And
simplify
then-
it more. Yeah.
And then you have electronic, noisy, electronic, quiet. Somewhere you say this is electronic, and then you have only noisy and
Oh,
quiet,
yeah.
right? Everybody knows, oh, this is the electronic measurement.
Yeah.
For noisy and quiet. And you have side by side, you will have the manual, noisy and quiet. And
Okay.
it's always good to have the quiet first and noisy so that you can see, oh, it's increasing. Right? So all of this can be switched. You can play with your graphs.
Okay.
Oh, okay. Yeah.
So
So,
you-
so you're saying that the quiet should be first and then,
Yeah, since
Yeah,
it's
okay, yeah.
increasing and then
right. Oh yeah, you're showing the increase.
Mhm.
Okay.
Mhm.
From left to right.
okay,
Yeah. All right. So I think we should be good then.
you should be good.
We'll work on
We'll
that.
work on it, yeah.
Work on
We'll
that.
take pictures
Yeah.
right now.
Yeah.
Yeah.
Take beautiful pictures.
Yes.
No trash cans or
No
anything.
trash cans, no water bottles on site.
Okay,
Right?
good job. Okay, your results are very good.
Yeah.
Good job.
Yeah, no,
Yeah. Good job.
thank you so much, yes.
And then once the poster is done, we set up a meeting or schedule with me next week so that we can practice.
Oh, the wording and the presentation.
Oh, your
Okay.
presentation, perfect.
Do you have like a day of preference?
No, give me some times next week that you would be able to come in for 30 minutes or an hour so that I
Okay.
can hear you. So practice before you come in,
Okay.
okay?
Yeah.
And then
Tuesday?
I will give you feedback.
Okay.
What time Tuesday?
Because I don't think we have.
Do we have a chance to
We don't
we
have
have
seminar.
seminars?
Huh?
do we have a chance
we
to
do
make it to the
have.
finals?
I don't know. I don't
It
know.
depends on how we
I-
tweak
I-
it or what.
I'm not a fortune teller.
All right.
So next week when? Let's set up the time.
Okay. Well, we don't have seminar right on Tuesday
No, but we have ethics.
at 1.
Do we have boards?
We might.
I don't think we have words.
Okay. So
Can
then.
we, what will we email? We'll find out and email her.
Yeah, can we email you?
Yes.
Okay.
Because we
'Cause
also
we
have
don't
a
know yet.
project for the other class. Okay.
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 Good.
Okay, thank you.
Thank you, Dr. Wong.
Okay. Thank you.
Bye.
Bye.